Hi, everybody. I'm Dr. Malou from the Silm Center for Mental Health. Today's topic is acceptance and commitment therapy for anxiety. I feel like this is such a timely topic. If you didn't have anxiety before the pandemic, certainly some of us encountered it during the pandemic, and now we're kind of left with a whole bunch of it. So really excited to hear from our Silm therapist, Mona Atrzadeh, today. And she's going to take it away from here.
Perfect. So, hi everyone. I'm just going to get us started with the slideshow. I'm just trying to find a way for us to share it, which I think should be fine. So, there we go. All right. So, hi everyone. My name is Mona Atrzadeh, and I'm a clinical associate at Silm Center for Mental Health. I have a master's in psychology, and I'm actually currently back in school pursuing my doctorate in clinical psychology at Adler Graduate Professional School. I've experienced working with children, adolescents, and adults, doing things like therapy and assessments under supervision by a registered psychologist. So anxiety is something that I do tend to see quite a bit. So definitely a very important topic, just like Dr. Sahar also mentioned. And basically today's webinar is really going to talk about acceptance and commitment therapy for anxiety. It is going to be more of an introduction and some strategies and tools to help support things like anxiety and its accompanying symptoms. So we're going to start with a bit of an overview about what we're going to be talking about today. So I'm first going to go over anxiety, what it is. We'll then discuss acceptance and commitment therapy, also known as ACT. We'll also look at some of its models, so Hexaflex and the Triflex, which sounds complicated, but we'll get into it and hopefully uncomplicate it. Next part will be the choice point. And last but not least, we'll also talk about ACT strategies. So we'll start off with talking about anxiety. So what is anxiety? We hear this term a lot. And there's a lot of words that kind of can sound quite synonymous to it. So things like uneasiness, feeling overwhelmed, worrying, nervousness. And it's something that most people have experienced, are currently experienced or have experienced, and or even know someone who has experienced anxiety. So it's obviously a very important topic. We can essentially describe anxiety as being an individual's response, both physical and mental, to things like uncertainty and or an anticipated threat. And to everyone, anxiety can look different. So it's also important to acknowledge that anxiety is very protective. There's a reason that we experience it, and that, as I mentioned before, that it's quite normal and a lot of people experience it. However, it can be concerning when anxiety becomes too pervasive, or when we notice it starts interfering, or it's bothersome or debilitating. So it's really important to have some support or tools in place to really help us support oneself when that happens. There's a variety of anxiety symptoms that you may have experienced, someone you know may have experienced. And those are things like increased heart rate, increased breathing rate, irritability, challenges with sleep, concentration, feeling restless, tense, sometimes digestive issues as well, dizziness, sweating. So quite a variety of symptoms that can accompany anxiety. And hopefully today, the hope is that, by introducing ACT and its accompanying strategies and tools, that not only can there be a decrease in some of those symptoms, but also a decrease in the intensity, in addition to hopefully the duration and frequency that one experiences them. So the next thing we're going to talk about is ACT. So ACT stands for Acceptance and Commitment Therapy. It's a type of therapeutic modality. So a lot of us hear words like CBT, DBT, and so ACT is also a modality that many therapists draw from. And basically, ACT encourages individuals to move towards accepting the difficult aspects of their lives and refocusing their attention and actions to better align with their values. And through things like mindfulness skills and other things we'll be talking about today, one is able to do so. When experiencing anxiety, what we notice is that individuals will typically get lost in their thoughts. And that really gets in the way of being able to do what one wants to do and achieve things that one wants to achieve. We may even say that sometimes with these thoughts, these unbalanced and or negative thoughts, that individuals confuse with those thoughts, which results in these really consequential behaviors. Individuals typically feel encouraged to push away these difficult emotions. So typically what we do first is push it away and push these emotions like anxiety away. But what ACT postulates is that individuals should be open and make space for those difficult emotions so that they can be less threatening and less overwhelming. Additionally, ACT also acknowledges that there are thoughts that accompany anxiety and how anxiety can wax and wane. And it's important to note that sometimes anxiety doesn't disappear, it may come back. So it's important to find novel ways of responding to them. And instead of directly targeting specific symptoms, ACT also primarily works with things like altering the relationship one has with those uncomfortable emotions and thoughts as well. So reframing kind of that piece is important. And again, as I mentioned before, while most individuals will try to really control the emotions that they're experiencing, ACT's goal is the opposite. One is told not to try and control or even avoid their challenges, but again, to make space for them so that they can redirect that energy elsewhere and things that directing their energy to places that have more value within their lives. So I'm just going to do kind of a quick summary of what I said, because I said quite a bit, which is ACT aims to do two things. The first being supporting the individual to build acceptance for things that are out of their control, but also make a commitment in taking steps that are needed to work towards a life that aligns with one's values. And one way this can be done is through improving one's psychological flexibility. So how do we get to psychological flexibility? How does one attain that? So this can be achieved by the Hexaflex. It's an ACT model. It encompasses 6 different parts. We have diffusion, acceptance, contact with the present moment, self as context, observing self, values, committed action. And so diffusion, we'll start off with. That part basically states that one should diffuse themselves from their thoughts. Those difficult, uncomfortable thoughts, we want to diffuse from that. And this can be achieved by acknowledging that one's thoughts, one's memories are nothing more than words or images, that they aren't as dangerous as that fusion makes one think that they are. The second part of the Hexaflex is acceptance. So the individual opening themselves up to make space for all the thoughts and emotions they experience, not only the good, but the uncomfortable ones as well. Contact with the present moment is being in the here and now, in the present, aiming one's attention to what they're doing in the present moment and absorbing, immersing themselves into it. It requires individuals to turn off autopilot mode and be fully present and aware, which can sometimes be really hard to do, especially when there's so much going on. Self as context, observing self, is continuously checking in and being observant of oneself, noticing the comments that we say to ourselves. Values, exploring and identifying what matters the most to you, what is significant to you in all areas and aspects of your life, including what's important for you and for those around you. Committed action is using those identified goals to set objectives and engage in the actions needed to attain them. The 6 parts of the Hexaflex we just talked about from that model can actually further be translated into the Triflex. So we can see it here, and kind of at the core is that psychological flexibility that I talked about earlier. In order to kind of gain that psychological flexibility, we have these 3 parts of the triangle. So being present, and that can be attained through things like contacting the present moment and self as context, doing what matters by engaging in one's committed action and values, and opening up. And that can be achieved by doing things like promoting acceptance and diffusing from those negative thoughts that we were talking about moments ago. In other words, we really want to guide our focus, our attention, while also being intrigued and open to the things that are most important to us. Making space to what happens, including being open to the various emotions and thoughts, the good ones and the ones that we think are bad, and finally living by our values. I want you to take a moment and think about what are some of the values that you have, that you hold really close to you and that are really important to you. Just think about them for the next couple of seconds. What would they be? And now I'm going to show you just how many possible values one can have. And I should mention that this list isn't exhaustive, even though it's quite a lot there, but there's some that may not be part of this, and that's okay. It's really to draw our attention to just how many values we may identify with, but also how many we may not even recognize that we actually have. And so, when we're talking about anxiety and we're talking about things like psychological flexibility, to get to those values, we want to talk about the next part, which is the choice point. So on a day-to-day basis, we engage in things and different actions. Some of these actions will move us towards where we want to go, taking the steps that make us feel good, feel gratified, feel positive. These are known as those towards move. But there are also actions we sometimes engage in that take us away from where we want to go and make us experience more of those negative and unbalanced emotions. It's important to note that in the moments where things are going the way we want them to, we're more inclined to engage in those more towards movements, making those steps towards things that make us feel better and fulfilled. But unfortunately, the reality is that we often experience a lot of challenging things and moments that go on in our lives that bring up things like negative emotions and negative thoughts. Like sometimes individuals might have the thought, I'm going to fail. Or even things like, there's nothing I can do. Things aren't going the way that I would like them to, or I need them to. When things like that happen, what ends up happening is we become hooked by those uncomfortable and negative thoughts and emotions, which again causes to further those away moves. Only when you're able to really unhook yourself and kind of move away from those uncomfortable emotions and thoughts can we go towards where we want to go. And this brings us back to values, which is really essential to what is going to help and encourage you to make those towards moves. Right? So again, a reminder of these are the important things that we want to move towards. So how do we unhook? There are many different ways for one to unhook themselves, one of which is this tool under the ACT umbrella of tools, which is noticing one's thoughts. So to do this, you want to start by first thinking about the uncomfortable thought. Perhaps we'll use an example of someone who's feeling really anxious about an upcoming test, and they may have the thought, I'm going to fail. So I want you to all use this example kind of for yourselves right now and put yourself in that position that I'm going to fail at this big test tomorrow and I'm not ready. And I just, even though I prepared for it, I still feel like I'm going to fail. And I want you to really think about it. Don't negate what it says. Don't push it away. Let yourself get hooked by it. Tell yourself it's not going to go well. It won't go to the way that I want it to go. Now I want you to silently say those thoughts in your head, but in front of saying, I'm going to fail, I want you to say, I'm having the thought that. Now saying it one more time, this time telling yourself, I notice I'm having the thought that I'm going to fail. And so what this basically does is it allows us to notice this thought and really restrict it. Also create space and create some type of barrier with it. And this is one way of unhooking oneself from those thoughts. Another helpful strategy is something called dropping anchor. And this strategy can really complement the one that we just talked about, which is noticing the thought exercise we just tried. And it supports really contacting the present moment, really engaging oneself in the present. So, one way that I like to picture the anchoring is by imagining that there's a boat out in the sea and that there's a storm coming, but this boat is nowhere near any shore. So, what the boat would likely want to do is anchor itself to keep itself grounded. So, let's talk about what are the steps for anchoring. So, anchoring requires these following steps. So, the first thing is asking oneself, what is my mind telling me? What are the negative thoughts that are attached to the uncomfortable emotion I'm having? One might think, I'm worrying about meeting new people. Or again, in that other example, I'm worrying I'm going to fail. Secondly, you want to acknowledge the uncomfortable emotion that's coming up for you and name it. Give it a name. It might be anxiety, or again, some of those synonyms of feeling overwhelmed, fear, name it. The next part of this might feel a little counterintuitive, which is normalizing. You want to normalize the feeling that the emotion that you're having is normal. To tell yourself that it's normal that I feel this way. And this is another way to do some of that unhooking by normalizing it again. It's creating that space and acknowledging that it's normalized and allows for unhooking. Next is wanting to try to identify where in the body is that emotion being felt. Where within, is it in your chest? Is it in your stomach? Where is it being felt? And then taking it a step further and asking, can I make space for this feeling? Once that space is acknowledged, you want to give the emotion, such as the anxiety that we're describing, permission. That, of course, while you're experiencing this emotion and these feelings, you may not like it. And that you recognize that it's taking a lot of energy away from you. And that instead of, again, pushing it away, you're going to reclaim and take back some of that energy by being open and curious to that emotion so that you can sit better with it. By doing this, it opens oneself to being better able to accept the emotion and thereby neutralizing it. The next step is connecting with one's body. This one's a really important one as well. This one, the way that we do this is by noticing that our body is controllable, that it's movable, that we're able to reconnect with it, reminding us of our autonomy that we have. And there's different ways to do this as well. One way to do this is by straightening one's posture, sitting up high, and slowly noticing each part of one's body. So you may want to start with your toes, noticing your legs, noticing your stomach, your chest, your arms, your fingers, your hands, your head, really reconnecting with all the parts of your body. You may even want to gently start to move those body parts around. So starting to wiggle the toes, stretching the body. This also helps us further reconnect with our body and also realize the control that we have over it. And lastly, what might be helpful is to really push those toes and feet into the ground, really physically anchoring ourselves where we're at. The next and final step is engaging. You want to engage with the world around you. This again goes with that present piece. So this can be done by noticing the environment through our senses. So seeing, touching, hearing, smelling, tasting, those can really help engage oneself back into their environments. So can do that by naming what's around you, even right now, what's around you in the present moment. Listening, besides my voice, what else do you hear around you? Touch, feeling around you, what's around you and feeling it, being tactile and touching the clothing on your skin. Um, Smell, finding something to smell around you. And then taste. So either finding one of your favorite things to taste or something sour to really bring you back to the present, or if there's nothing around you, imagining and remembering and trying to think about a specific taste and trying to remember that. This really, doing this and engaging in these senses really helps an individual to engage with their present surroundings and brings them back in. And when engaging in these steps, you know, it allows for that anchoring and in turn helps with the unhooking, helps with the diffusing, all of those parts of the hexaflex that we were talking about and the triflex we were talking about before. And hopefully, with becoming unhooked, you're able to make those towards movements and go to where you want to need to go to really align yourself with those values and hopefully feel more secure and less anxious. And similarly to what we discussed about that anchor in the storm, that both with the anchor, we could acknowledge that it wasn't the anchor itself that made the storm go away, but that it helped create the stability to withstand it. Thank you. I'll stop sharing. One more. There you go.
Thanks so much, Mona. So now we're going to open it up to questions from the group. If you guys could just send your questions to the chat, I'll share those with Mona and she can answer some more questions. That was so helpful in terms of strategies and just really concrete ways to deal with anxiety. I think everyone can identify, but sometimes get a little lost in what to do after the identification. So thank you for that.
Of course, thank you.
Okay, here's the first one. Sometimes I feel really anxious before I go to sleep. Is any of the strategies that you mentioned better for different times of the day or different times that you might feel anxiety? My anxiety at work is different than my anxiety before I go to sleep. Can you help?
Definitely. So the nice thing about these strategies is they're not time specific, they're not situation specific. They're actually really meant to help any individual at any time, which is really nice. One thing I also want to comment too is kind of practicing these strategies and seeing what works for you. Some strategies might work better for you at different moments or at all moments, and finding the kind of this toolbox of strategies and tools to really help you when you're feeling anxious.
Okay. Here's the next one. How do I identify my values?
So that's a great question. And it's not necessarily to say that you have to find them and that they're rigid and that they can't kind of fluctuate or change or turn into new ones. It's kind of just checking in with oneself, being present with oneself, asking questions of what's important to me right now, what's important for me right now at work, what's important right now for me at school, what's important for me right now as a parent, as a child, as whatever role that you may play in different avenues of your life, but then really bringing it back to yourself and figuring out what's important for you, and also reminding yourself that it can change and you can add new values or take things away and replace those. So to also know that it's okay for that to change also may make it feel a little bit easier.
Yeah, seems like a really good way to clarify, right? Like if you're confused about something or you feel overwhelmed, just kind of asking yourself that one question, what's important to me? And like you said, it might have changed since the last time that you checked in with yourself or that you asked that question. So we might even be surprised at something that we hold to be important after a big stage, like a life change, like becoming a
For
parent.
sure. For sure. For sure.
Yeah. Let's see what the next question is. I've heard that ACT also incorporates humor and metaphors. Can you help me to understand how these fits in with the things you've talked about today?
Definitely. So actually, I wasn't sure like which ones to include, what not to include, because there's so many. I felt those two are really helpful, and they're things that I use with my own clients at times as well. So I find that they can be really helpful, but there are some funny ones. So like one of the strategies that ACT uses is kind of talking to yourself in a characteristic voice while you're saying the thoughts. And that can help with kind of some of that unhooking or the diffusion as well. So it's again kind of trying to create distance with a thought, like acknowledging that it's there, but creating the space. And so by approaching it in a more comedic way can be helpful in doing that.
Okay. And is the idea with not fighting the thought, like kind of like letting it in or working with it, is the idea so that it doesn't take up too much of your energy, that essentially that's going to be the only thing you're paying attention to rather than the things you can commit to changing or the action steps that you can take if you're so engaged with fighting the feeling?
One, like beautifully said, that's exactly really what it encourages, because sometimes we don't realize just how much energy we're putting into things like anxiety and all these really uncomfortable emotions. But when we take a step back and take a look at it and see, wow, this is getting in the way of me being present with my family, being present with my friends, being present with myself, um, creating that distance and acknowledging and making space for it. Again, kind of going back to the point I made about um, that, with things like anxiety, it waxes and wanes, that it may come back. And just knowing that you have space for it and that you can sit with it and redirect some of that attention and energy elsewhere.
Yeah. I mean, it's a really interesting idea to think that, because anxiety is evolutionarily supposed to be there because it's serving a purpose, actually
Yep.
helping us. We think like, I'd rather just not have this, right? It'd be nice if it would just go away. In fact, A, it's not possible. And B, we're spending so much energy on that when if we could have a different relationship with it, it would make room for all the things that we want in our life anyways.
100%. And if we didn't have it, like you'd go pick up maybe a poisonous snake, you wouldn't be as weary about it. So it's really important. There's reasons why we have it. And again, it's normalizing that we have it. It's just trying to find better ways to manage it.
Okay, I think that's all the questions I have here. Just give everybody a minute to send any additional questions, anything else that people want to ask. Doesn't look like anything's coming through right now, but we'll let you sit with that information. And this webinar will be on our website at silmmentalhealth.com. And if you have any questions about your own anxiety or about getting more strategies or about connecting to someone to talk more, you can just email us at admin@silmmentalhealth.com. So check out the webinar, send it to friends or family you think might find it useful. And also feel free to email us at any time with any questions that you have. Okay. I want to thank you so much. Really appreciate you sharing that with us. I hope there's a part two that just tells us that much more. Um, and maybe we'll say goodbye to everybody now and let you think about the topic for today.
Thank you so much. Thank you, everyone.